AISMAC and the support of patients and their families. The history of the AISMAC is similar to one of many other rare diseases associations. Two people, Carlo and Paola Celada, with a direct experience of diseases almost unknown in Italy, took steps and to find as much information as possible from the most qualified centers operating abroad, and to call for greater concern from doctors and institutions. They have soon realized that it is necessary to form networks with other patients because together we are stronger. AISMAC was born on the 19th of May 2005. Over the past 12 years, many things have changed, but the tasks and the goals of association have remained the same. Today, as in the past, the main task, Okay, we are not. Today, as in the past, the main task of the association is to listen to support, and to inform patients and their family members who are often lost in the face of variety and little knowledge of the disorder, unconvincing and often diverging medical opinions, difficulty on finding objective and comprehensive information, and even lack of understanding from their close friends and relatives. Whoever turns to AISMAC for help knows that they can find someone who understands them and speaks their own language, because the association's members have gone through similar experiences. No physician, not even a psychologist, can replace a patient's association in this role of support. Our help is often expressed in very concrete forms: everyday life tips, information on the lives of rare diseases patients, assistance with the relationship with doctors, employers, and teachers, and etc. We now support around 3,000 patients over the country, and we receive new contacts on a daily basis. In addition to the headquarters in Turin, well-prepared regional reference support patients on a local basis. In addition to the headquarters in Turin, some well-prepared regional reference support patients on a local basis. In order to be closer to patients, we also encouraged the creation of local groups spread across many Italian regions. Very popular is also the Facebook group Friends of AISMAC, which counts over 2,000 members. AISMAC and information. In order to provide information to patients, we need to prepare and update ourselves on a continuous basis, as indeed another of our core activities is the collection and dissemination of knowledge and information on pathologies, diagnosis, and treatments, methods, healthcare facilities, and specialized doctors, and on the regulation affecting people with rare diseases and disabilities. Our commitment in this area has never failed, because we are strongly convinced that only by knowing a disease we can fight it, and that an informed patient is a step ahead. Our commitment to patients is not only to help them at the time of need, but also to assist them in acquiring greater awareness and take over the reins of their well-being. The first source of information is, of course, patients or family members who turn to us and tell us their stories, their symptoms, and their experiences. Other sources are information, are scientific literature, conferences, specialists who we're in contact with, and other national and international associations and federations dealing with rare diseases, patient rights and disabilities, etc. Also, in the context of the dissemination of information, the role of patient association is a typical absolutely typical, since no other person can guarantee the same impartiality. Of course, it must be continuously emphasized that the association is not made by physicians and can never replace doctors' advice. AISMAC main information tool is AISMAC website, created in 2007 and accredited with the on-code certificate of assurance. We have now intensified the activity of translation of articles, scientific articles, which we expect to publish shortly. Other important tools are our books, in particular the translation of the Chiari book by John Oro and Diane Mueller, the book with the transcription of Dr. Bolognese's video tutorials in Italian, and Francesca Ricci's children's booklets. Then the medical and scientific videos published on our YouTube channel, the information sheets and booklets that can be downloaded from our website and distributed to doctors, teachers, etc., our official Facebook page, and doctor-patients seminars. We recall January 2012 meeting in Turin with Dr. Bolognese and other Italian experienced specialists, and our 10th anniversary meeting again in Turin in November 2015. AISMAC and support of medical practice and research. The third area that distinguishes AISMAC activity is the promotion and research for support for hospital projects related to our disorders. This is an area to which we have dedicated and we continue to dedicate a lot of efforts. In Italy, there are some doctors who constitute important points of view of reference for us, with whom we have a continuous dialogue. Despite this, in many cases, the relationship with doctors is not easy, not even when we would like to support them in their projects. There are bureaucratic obstacles, and there are also cultural obstacles. One of such obstacles consists of a typical Italian feature, the presence of several excellent neurosurgery organizations, not exclusively devoted to our pathologies, as there are in the United States or France, for example. Moreover, the different centers are not coordinated with each other. Indeed, they are often in competition. Another cultural obstacle is the lack of interest in our pathologies by doctors, which is partly due to the lack of interest of pharmaceutical companies and the lack of money for research. Some significant projects for which we have promoted economic contributions were successfully completed. We like to mention logistical and economic support for the implementation of the Consensus Conference on Chiari in Milan, organized in May 2009 by the Besta Institute and for the subsequent publication of the Acts. We have been advocating psychological counseling at Besta Institute for years, and the multidisciplinary clinic for Chiari malformation and Syringomyelia, which has received some hundreds of patients and has become an important reference point over the past 2 years. We are now currently supporting 2 major research projects. The first project has seen us involved in the organizational support and communication phases and was launched last year by Dr. Marco Castori at the Laboratory of Genetics at San Camillo Hospital in Rome. It studies the relations of Chiari malformation with hereditary connective tissue pathologies, following the pioneering work of Dr. Milorart. The forms submitted by candidates were over 100 and on this project we have many expectations because more and more patients are diagnosed with connective disease only after a negative outcome of the recuperation surgery. The second project genetics in familiar forms of Chiari malformation and Syringomyelia is the result of the international cooperation between the Duke Center for Human Genetics at Duke University in Durham and the Regional Expert Center for Syringomyelia and Chiari Malformation, CRESC, of the Azienda Ospedaliera Città della Salute e della Scienza di Torino, that is a state hospital enterprise organization, Citadel of Health and Science of Turin. Since Duke University decided to extend Chiari's genetic study to patients in other countries and reached an agreement with CRESC, coordinated by Dr. Palma Ciaramitaro, about 450 blood samples have been collected and will now be catalogued and then sent to the United States. AISMAC has founded a scholarship for a medical laboratory technician carrying out this activity under the supervision of the geneticist Dr. Salvatore Gallone. AISMAC toward the future, the importance of networking. For the future, we intend to continue along the path taken, but we have to deal with a constantly evolving reality. Knowledge about the pathologies is changing at great speed, and this conference is confirming it. The old classifications are no longer valid, and we are having trouble addressing a patient. Nowadays, fewer patients turn to us with the classic Chiari and with classic Syringomyelia, but we are increasingly witnessing associated diagnoses of endocranial hypertension, connective tissues problems, craniovertebral junction anomalies, and genetic syndromes. Therefore, we have to get constantly and increasingly informed, and we have to provide a continuous stimulus to doctors, researchers, and institutions. We must be able to carry out multiple activities that require a certain specialization. We must be more incisive in communication and fundraising activities. In order to do all this, we need to renew ourselves without denying the principles and objectives that have characterized us so far. Over the last few months, we have been working on strengthening our staff also through training of our collaborators and the establishment of working groups. And in the scenario waiting for us, it will be increasingly important to network with other subjects dealing with diseases and rare disorders in general, namely doctors, institutions, and associations. In particular, one of our first goals is to resume contacts with foreign associations. In 2007, AISMAC was among the founders of the European Group of Association of SM and SM1, ESG, European Syringomyelia and Chiari Malformation Group, which the United Kingdom, France, Germany, Spain, Belgium, Austria, and Denmark joined too. Unfortunately, the group had to stop its activities for lack of people who could take care of it. But now is the time to resume the project. And here we are launching our appeal to our fellow members in the room, also in relation to the challenge posed by the European Reference Network for Rare Disorders, that is ERNS. The role of associations. We would like to make one last consideration about the central role of associations, which can and must be acknowledged. This central role does not come just from the dirty work that associations take on to fill institutional gaps, but also for their specific skills and their unifying role. Associations want to be heard because they have a lot to say. It is therefore desirable that henceforth they will be accepted fully, together with the other subjects dealing with rare disorders, that is, doctors, heads of health and social care institutions, public institutions, in the places where decisions are made, commission and scientific forums, with respect of specific roles, but at the same level of the other actors. Thank you for listening.